It's hard to believe watching him play football with his friends, but Rabi was born with club feet. Rabi's mobility was restored at Impact's health centre in Bangladesh, and the treatment cost his family nothing. Without Impact's help, Rabi would probably have remained disabled for life. One in 10 of the world's people are disabled. 75% of them live in the developing world. Over half are needlessly disabled by conditions that could have been prevented or could be reversed. Working with local partners in Africa and Asia, Impact takes the hospital to remote areas where healthcare is non-existent. We have already restored sight, hearing or mobility to over 500,000 people, but so many more need our help. Disability keeps people in poverty, but treatment enables them to support themselves. Impact's modern mobile hospitals, the Lifeline Express train in India and the Jibontari floating hospital in Bangladesh, travel to rural villages. The medical teams on board provide surgery to thousands of impoverished people each year. Most thought they would remain disabled for life. In Nepal, a sterile operating theatre tent is erected in which surgeons restore hearing and mobility. However, Impact believes that prevention is better and more cost-effective than cure. Our greatest hope is that one day our mobile hospitals will no longer be needed. It is a human tragedy that so many people are disabled by conditions which could have been prevented simply through better nutrition, basic healthcare, safe water or sanitation. When people understand how to improve their health, they are keen to take action. We particularly empower illiterate women with information that can prevent disability, such as small amounts of green leafy vegetables can protect eyesight. Health issues are interlinked, and we tackle the root causes, replicating tried and tested action that we know really works. This brings lifelong benefits and helps to reduce dependence on aid. Neglected health problems can cause permanent disability, but in the developing world, most people have little hope of treatment. Impact screening clinics provide free assessment and timely treatment to over 2 million people each year. We also train local people to check the health of those around them. For example, teachers and health monitors examine their pupils and classmates. Every minute, a woman in the developing world dies as a result of pregnancy or childbirth, putting her other children's lives at risk too. Most rural women give birth without trained help, which is often fatal when complications develop. Impact trains traditional birth attendants, provides sterile equipment, and runs mother and baby health clinics to keep women safe. We also immunise young women against rubella, better known as German measles, because the disease can kill or damage the unborn child. This action is saving lives and preventing disability. Immunisation is the most cost-effective tool against major killers such as polio and measles. Yet, tragically, many children in the poorest countries are still not protected and die or become disabled as a result. Impact raises awareness and vaccinates the most vulnerable people. 800 million people are malnourished, making it the biggest threat to global health today. Malnutrition compromises immunity, hindering our ability to fight off disease, and weakens mothers who die in childbirth or have stillborn babies. Lack of vitamin A is a leading cause of child blindness. Impact teaches people about nutrition and provides seeds and tools so they can grow vegetables to supplement meagre diets and earn money. Mr. Saha in Nepal told us, "We understand now that we should eat green vegetables. We used to think that only rice and bread with some salt was enough for us." In the UK, our eating habits threaten a public health time bomb. For the first time, our children's life expectancy could be shorter than our own. Action is needed, so Impact works in our local community, teaching nutrition to children and vulnerable groups and encouraging people to grow vegetables, which has been so successful at improving health overseas. Clean water is essential for life and health. We turn on a tap, but for people in Asia and Africa, collecting water is an arduous task which usually falls to women and children. It's often filthy and disease-ridden, but with no alternative, they are forced to drink it and wash with it. 5,000 children die every day from waterborne disease. Without safe water and sanitation, good health is impossible, so Impact installs wells and toilets, helping people to understand that their children will stop getting sick if they use them. We take so much for granted: clean water, sanitation in our homes, enough food to eat, and medical care when we need it. Diseases that kill and disable millions of people in the developing world every year are long forgotten here. But life for those in extreme poverty is a daily struggle for survival, lived in the constant shadow of needless disability. Impact is working hard to change this situation for thousands of men, women and children every year, but we need your help. Every pound you give will make a difference within our cost-effective programme. Your support could restore another person's sight, hearing or mobility, or repair cleft lip for a child. Or you could protect people from the needless disability which burdens so many lives and keeps whole families in poverty by training a health worker, establishing a vegetable garden, or providing a well. This film is just a snapshot of Impact's work. To learn more or to make a gift, please contact us on 01444 457 080. We are waiting to hear from you. Your support today will prevent disability tomorrow.